So the third topic I'm going to talk about is the impact of anti-VEGF injection on IOP and the optic nerve. So this is another work stream that we've worked on in the Vision Academy. So just some background. So acute short-term elevation of IOP can occur in some patients, and in terms of the IOP increase, what is defined as ocular hypertension? So basically, any IOP above 21 to 25 or 10 to 5 millimeters mercury above the baseline for at least 2 consecutive visits, these might be considered, but the variation varies in the literature. So because of the increased IOP, there might be some chances that, especially in patients with glaucoma, that they can have progression, or even those without any pre-existing glaucoma, they can develop glaucoma. So nowadays we have agents which has actually higher injection volumes. For example, 8 milligrams, aflibercept is 0.07 mil. But if you look at the GA drugs used in the States, they are actually 0.1 mil of injection. So you really need some guidance on how to deal with these injections of higher volumes. So just to recap, sustained IOP elevation greater than 21 to 25 millimeters mercury, or 5 to 10 millimeters mercury above baseline for at least 2 consecutive visits. So in theory, this can damage the optic nerve. So it's been shown that sustained IOP rise can cause RNFL, retinal fiber layer, and optic nerve damage. And in particular, patients with pre-existing glaucoma, they already have a thinning of the retinal fiber layer, and therefore repeated injections sometimes might cause some damage. So how do we deal with these cases? So IOP can be medically controlled. We can use anti-glaucomatous medication, or you also do laser trabeculoplasty. And in previous filtering procedure, these patients sometimes they have spikes. But sustained IOP elevation, if you look at the clinical trial data, it's actually quite rare, and you can actually, if you just use anti-VEGF injection, it's quite rare and can be managed quite well topically. How about the correlation between the anti-VEGF injections and reduction in retinal fiber layer thickness? If you look at the recent meta-analysis, actually, the clinical relevance of these are actually not too clear. So in a small study of 16 patients with glaucoma who are receiving continuous anti-VEGF injections, they found that the retinal fiber layer thickness was actually not significantly different compared with baseline. So this suggests that patients with glaucoma who are having anti-VEGF injections, provided their IOP is well controlled, they might actually not be at risk of having further damage to the retinal nerve fiber layer compared with those without glaucoma. So what's the recommendations from the Vision Academy? So these are patients, in all patient group, they should be monitored if they have any sustained elevation, and consider treating these patients with a glaucoma specialist. So these are the the recommendation for patients without any history of glaucoma. So basically, monitor their IOP, assess the optic disc with biomicroscopy, OCT, performed regularly. So in addition, you should consider doing baseline static Humphrey perimetry, doing the disc OCT, and looking at the retinal fiber layer imaging baseline, and then every 8 to 12 months. For intervention, if they actually had some increase in IOP, then of course you can consult your glaucoma specialist friend using one of these agents: beta blocker, carbonate anhydrase inhibitor, alpha agonist, or prostaglandin analogs. And also consider, if you don't want to have these IOP spikes so frequently, then consider extending the treatment interval, or using some drugs which can actually extend your treatment interval. In cases where it's more complex, they have sustained IOP elevation, and also other conditions like RV or severe diabetic retinopathy, because these patients already had their optic nerve impaired. So you should actually monitor these patients with a glaucoma specialist. Also, patients with pre-existing glaucoma, again, consult your glaucoma friend. Gonioscopy can be performed especially in RV and severe diabetic retinopathy just to exclude any new vessels in the angle. And then you can monitor these carefully and consider even prophylactic IOP treatment before the injection. And if they are very high spike, consider corneal paracentesis. So just to summarize, the Vision Academy developed some recommendations on the monitoring and treating IOP elevations for patients requiring frequent anti-VEGF injection. So patients already with some transient amaurosis should receive prophylactic pre-treatment for lowering the IOP. And the risk of these actually is very low, but you should still monitor them and consider monitoring together with a glaucoma specialist. So just to recap, you can find the guidelines in the Vision Academy website, and this is the QR code for it. Thank you.